finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Okay, welcome back. This week we're talking about caring for aging parents, which can be a difficult and emotionally taxing experience. May and I have gone through this a lot, actually, in the last several years. As parents age, they can become increasingly dependent on us and they need help with activities of daily living. And these challenges are unique. It's, sometimes feels like you're raising children, but you're not. These are your parents. Our guest, Janice Goldmintz, is an expert in gerontology, the study of aging, and she has firsthand experience with caring for her parents, both of whom had Alzheimer's disease. She works with families, companies, and retirement residencies to help create the highest quality of life possible for older adults. She brings attention to important issues like family dynamics, resistance from parents, and the need for long-term care planning. In this episode, Janice provides valuable advice on how to navigate aging parents with care, organize important documents, and take care of oneself first. She also emphasizes the importance of talking openly. Cannot emphasize that enough about end of life, getting support where support is needed, and respecting patients while asking questions. It's an awesome show with a lot of information on a topic where a lot of us just kind of let this kind of slide and don't take it on. And the better you plan in these situations, the better the outcome and the better life is for everyone. So please enjoy. So we're back with another episode. I am back in Oregon. May is now in Hawaii because we're doing our separate vacations tour. And we have an awesome show today. We have Janice Goldman, who is going to help us navigate through some geriatric care issues. If you've ever had aging parents, it is a challenge for everyone. And we finally have an expert that is going to help us figure out the way to deal with these things. So Janice and May, welcome.
Thank you.
Hey.
Hi.
Hi, everybody. Nice to be. It's kind of weird being like in a guest panel on here, Tim, I must say.
It is. I love the control I have, though. Like I can push all the buttons and make things happen. It's really
Make
weird.
you disappear.
Right. So Janice, why don't you tell us a little bit about your training, what specifically you're doing, and what services you could offer to our listeners?
Sure. So my background is in gerontology, which is the study of aging. I am not a physician, but I come to it with knowledge of the aging process, how it affects families and the people themselves, and how to best create the highest quality of life possible. That is my goal with all of my clients. I had the immense honor of working with a geriatrician, and that's how I got started in this. And I saw how older adults can be taken care of in the most incredible way. And I was very inspired by that and went back to school and did the part that I can do. I would say that I am a consultant. I work with families, I work with companies, I work with retirement residences to, again, achieve the goal of creating the highest quality of life possible. I'm located in Toronto, but accessible across the world, of course, on Zoom like everybody else. The other part of it is I have been a caregiver for both of my parents, both who ended up with Alzheimer's disease. My father passed away 7 weeks ago.
Oh, my.
So I know firsthand all of the challenges and joys and everything else that goes with helping a parent have the best kind of life. And it's not, and I'm an expert, and it wasn't easy for me. So I don't expect it to be easy for anybody.
Well, and first off, we're very sorry for your loss.
Thank you.
We've had, May and I have, it seems like we've been going through this almost continuously for the last several years, like a lot of people. That being said, it is an interesting thing. This concept of essentially caring for your elderly parents, which usually, as I've told tons of my patients, falls on one child, not on a whole cadre of them, and usually a daughter, if they are fortunate to have a daughter. I've seen some unbelievable care from daughter-in-laws, which just is mind-blowing to me. My mother was like that for her in-laws. But it really is fascinating, because it's kind of like raising children. But if you do a good job raising children, your children leave and then they bring you back little grandchildren and everything's happy. Unfortunately, in caring for aging parents, the end result is death. And so it really, I mean, it's this weird paradigm. And then there's all these emotions that go along with it, all of the emotional baggage people have in their lives and families and whatnot. And all that has to be navigated while all these new medical issues start happening, because, you get old, you get sicker, and things happen. So,
well, Tim, what I would like to even hop in and say, maybe then she could start with this, is that the bigger thing is now in this society is a lot of people don't live near their parents anymore. So what happens as a broken up society, people are living across the country, not necessarily in the same city or town as their parents. Sometimes people move back, or aging parents will move back to be closer to their kids and grandkids, but not always. So that's a big obstacle. So Janice, like, what do you see as the big obstacles, like that, as being separate from your kids or other things, like, before we get into how to take care of some of the issues?
I think one of the major problems is that people don't share what's going on. Either the parents don't want to burden their children, so the children have no clue what's going on, especially if they're not living in the same geography. And so then the care is not optimal, because people aren't there to help or make suggestions or whatever. So that's one thing. The other is that sort of switch of dynamic from parenting your parent. The parents don't want that. They resist. I'm your parent. I brought you up, and now you think you can tell me what to do, becomes problematic in some cases. There's always family dynamics that play into it. Oh, she's the favorite. He's the favorite. He's the firstborn. I'm the baby. Male, female, exactly what you had said, Tim. So there's all of this on top of not living in the same geography. And it's really easy, if you're living somewhere other than where your parent is, to not be involved. And yet you may want to be, and that's another issue. You may want to be involved, and then you can't, so you feel bad for that. What I want to say is that there are people out there that can stand in for you. There's lots of services. There's lots of people who can be your eyes and ears, even if you can't be there, if that's what you choose to have happen. So if you're not living in the same place as your parent, it doesn't mean that you can't be involved in their care. There's lots that can be done.
So why don't we, I don't know what you're thinking, Tim, but why don't we start by talking about that, having the conversation from both sides of the place, because I think that's a big, important starting point. I mean, I could be wrong, but it's just even talking about it, like, well, our kids are just starting their adult life. They're in their 20s, but we are very open and talk about, what we would like to have happen if we were older, wishes, wills, where the documents are and things like that. But you go ahead and tell us, how to have the conversation from both sides of it, from the kids' point of view, or maybe the kids don't want to talk about, the parents do.
I think exactly what you said is so important, is to start at this age, because then it becomes part of normal life. It's not this cloud that hangs over your head, or, oh, we can't talk about that with mom and dad, or we can't talk about that with the kids. It becomes part of, this is normal. We want to make sure that everybody is up to speed. And hey, if something should happen, this is what we would want. This is where our papers are. I will say, in my own family, my ex-husband passed away at 54, something that his kids never would have expected. His youngest child was 19. You have to have these conversations. As challenging as they may be in the beginning, they are important. It's important to know what somebody would want or not want. It helps when a situation occurs, and you don't have to think, what would my parent want? It's here, it's on a piece of paper. Here's here's their living will. This is where they would want a DNR. This is where they would want no artificial hydration or nutrition. It's not my decision to make, it's theirs. They get to speak for themselves, and it takes the burden off of the family members who are already going through emotional turmoil, whatever. And for the older people, for the parents themselves, again, it's a sharing, it's being real, it's being honest, and knowing that your family is aware, and your kids are going to do what your kids are going to do. You have no control over that. But what I do believe is that your kids learned from what you do. And I believe that my children learned from how I took care of my parents. And I learned from how my parents took care of their parents. So not that that's the reason to take care of your parents because you want them to take care of you, but it is there. It is there. They're watching. What are you doing? And they're going to follow in that lead possibly. Yeah, so that openness, that transparency, I think, is important to have open conversations down the road where the bigger challenges start to crop up.
So do you have a checklist? Kind of obviously the living will is a huge piece of the puzzle. Where's the estate planning documents? Have you done any estate planning, which is kind of important? Do you have kind of like a pilot would get into the cockpit and go through a checklist with people? Because I think just like financial planning, a lot of people forget about this kind of stuff. Like my parents never told us where they wanted to be buried, whether they wanted to be buried, whether they wanted to be cremated until they're well into their 80s. And I'm like, maybe we should have talked about that. And like not even what province in Canada they wanted to be buried.
I was going to say part of that is to a generational thing where there was the whole, not pride, but like you just didn't talk about it. I remember that with my grandparents. Yeah. It was like big, you don't talk about death and dying, just like you don't talk about somebody's weight or their age or how much money they have. And that's changing. But yeah, to Tim's point, is there a checklist of things? Like I listened to a financial podcast once that was really good because it talked about print it out, tell your kids where your will is, the password to your computer that have all your documents or whatever. So, I
have a list of 25 documents that you should have.
Oh, wow. Okay.
Now, they don't apply to everybody.
Right.
If you're divorced, you want to have your divorce decree. If you've bought a plot somewhere, you want to have where that plot is. If you have safety deposit boxes, you want to have that information. If you have insurance policies, who are the insurance policies with? All kinds of things like that don't apply to everybody, but it gives you a good idea of the things to be looking at. And, and as you said, it has to be in one accessible place. And if you are concerned about privacy for whatever reason, then, put it on a stick. The stick is in the dictionary, whatever that is. As long as somebody knows where this thing is, or I have a real kind of thing with the technology, because let's say you put it on, a 4-inch floppy disk 20 years ago. Well, you can't use that now, right? So I'm very old school, and I really think you need to have it in paper.
Yes.
Well, what we did, which I think is, and it took us being married almost 30 years before we got to this point, but we had a will very early. We modified that in the last several years because the kids get older, things change. And, but it's basically 2 phone calls. Like if May and I were to like just get in an accident and die tomorrow, the kids call the estate attorney and our financial planner and every single piece of documentation they have.
Right.
So it's backed up. I don't know if it's cloud-based. We also have all the hard copy stuff, but hard copy stuff, that stuff is a little spooky too at times because, we got evacuated 3 years ago because of wildfires. You take what you can. We had it, organized so we could take that with us, but that's a big deal. You have to have the right kind of filing cabinet.
Right.
Even like that stuff is really important.
Like a fireproof safe. I know. I keep thinking, okay, this is irresponsible, but we need I have a little fireproof lock box to put some things in, like passports and a few documents and title to cars and houses. But you're right, it does need to be stored somewhere that's easily accessible and findable.
Yeah, because, if somebody passes away and they've got a cemetery plot, you have to have that documentation right away to do what you need to do. Finding it a month later isn't going to help you. So having that knowledge of where these papers are,
Right.
it's vital.
So that's great. And then obviously to get that checklist, we'll later we'll get a link from you so that that's easy to access. Because even I want to go through that again, because I always tell our kids, this is how to access stuff. But it would be nice to actually just have it, send them an email or have it in a piece of paper and give it to them. I'm like, okay, here it is, just in case something happens.
The
awesome.
nuclear football of your life.
There you go.
So I want to talk a little bit about guilt, because at least as a physician, I have dealt with in elder care. That is probably the most present emotion. There's obviously that people care about their parents and they love them, and that is obvious. But there's this idea. I don't know how many people have had to talk off the ledge because they're like, well, I won't put my dad or my mother or whoever in a home. And I'm like, well, okay, you didn't put them in jail and lock it up and throw away the key. But I'm telling you that what you're doing is dangerous, because you do not have the ability to care for your parent with the medical complications that they have. So you have to put them in a place where people are trained to do that.
Right.
Now, it doesn't mean that is actually the best care. So how often do you have to have these kind of conversations where you're kind of talking people off the ledge, and what sort of counseling techniques do you do so people actually, don't feel like they're just farming dad off in the, back 40, so to speak?
So I take sort of a very observational stance, and I say, you need to have a piece of paper on this side says pros and cons. So pros of keeping your parent at home and cons of keeping your parent at home. Pros of, I'll say, some other living situation. And if you can look at it from an objective way, it makes it easier. And there is a lot less guilt, because if you're talking about safety, I think that everybody understands that if having somebody at home is unsafe and having somebody in a residence is safe, then you would almost be guilty to keep them at home. You know what I mean? The other thing, though, that I want to say is that in most situations, you can make it work with a lot of due diligence, with a lot of outside help. If somebody is adamant that, no, my parent is staying in my home, there's things you can do. You have to have the financial wherewithal to do it, but it can be done. And if that is what somebody wants, you can make it work. I think that everybody has guilt no matter what they do. I should have taken them. I shouldn't have taken them. Oh, they're unhappy. Oh, whatever. There's so many things that go into those decisions. For the person themselves, for the older person themselves, if they've been living in this house or wherever for 50 years, the memories that are in those walls is a very hard thing to leave, no matter what. Or people are afraid. I have so much stuff. What am I going to do with it? Don't tell me I have to get rid of my stuff. It's my life. And we become attached to our things, right? And letting go of your vases and letting go of your pictures and all of that, it's very challenging. So I understand why all of this.
I was going to say, we moved, and that was hard, 30 years worth of stuff. And, we're just moving somewhere else. And even it's like making the decision to move. So sorry not to interrupt, but I think people can relate to that. And how do you, not just the guilt, I was going to say, as the child, but when the parent doesn't want to leave and the children are ready to put them in a home, that's a whole other battle. So go ahead, how to deal with that. Yeah.
So again, I think sometimes what kids will do is and the only word I can use is martyr themselves. I'm going to throw
100%.
everything at my parents. I'm going to give up my life and I'm going to take care of my parents. And then their life falls apart. That's no good either. It has to be the highest quality of life for everyone, given the situation, given all the parameters of the financial, the social, because if that child is married and has young children of their own, they have to make sure they're taking care of their own children and their own relationship with their spouse. If the person is divorced and this is the only sort of outside thing, you still don't want to negate your own life to take care of your parent. It's very hard to balance, but that balance is really important. And sometimes when you're in it, you don't see that everything is unbalanced, and it takes maybe a doctor or somebody else to say, hey, I'm looking at this from the outside, and this is my suggestion. And I really believe in bringing in other health professionals, because if I tell my parent, you can't drive anymore, is very different than their physician saying, you can't drive anymore. The physician has a different level of knowledge. They are seen as the expert. And if the person wants to be mad at their doctor, let them be. But when it's your child that is telling you, you can't drive anymore, there's guilt. There's where the parent can just pick away at their child. You ruined my life. You took my license away, or you ruined my life. You made me move into this beautiful retirement residence that's got food and social activity and healthcare, but you ruined my life by doing that.
Yeah, we're actively trying to move into something like that, actually. Not quite, but almost. Like we had a big acreage, and we're just like, I just want to live next to a golf course with a bunch of other 55-year-old people, So, but it is interesting. I think one of the hardest conversations is when everybody in the room except the elder parent understands that they're living in a situation that's dangerous. And I've had these conversations. And honestly, I don't even really know if what I'm doing is the right way, but you can't alienate people. So I said, look, the reason that you need to move out of your house is because it's dangerous. And it's dangerous at a whole bunch of levels. You could slip and fall and die, and you would slip and fall and die in your house around all your cool stuff and all the memories of your deceased spouse, and everyone's happy until your daughter has to come and find you dead. And people don't think about that. I mean, if I was left by myself and I was living in a home that May and I shared, and I wanted to stay there, I'd want to stay there as long as possible. But at the same time, it doesn't just affect the elder person, it affects your entire family.
Right.
And so this idea that you can kind of choose what you want to choose for you, I mean, part of that's true, but it gets really complicated. And so it may take several visits to kind of nudge people along the road where you go, you know what, you're going to have a better quality of life. That's the key. You're going to have a better life. You made an amazing life at the house you're in now. Now is for the next step. Isn't that awesome? It's a new adventure or something. I mean, you kind of almost have to salesman it, I find.
You do. And you have to also, though, be really cognizant of that person has a right to choose.
Yes.
They have a right to choose. It may not be what you decide. It may not be what you think is in their best interest, but if they have cognitive powers, they have that choice to make. And you may have to live with it. And that's the reality. You as the child or as the health professional, you may see a situation, and for you it's black and white. But for that person that has that ability to make those decisions for themselves still, they get to make those decisions.
That warms my heart to hear that, because I've had that conversation a bunch of times. I said, you need to understand what you're consenting to, but it's your life. It's not mine. It's not your daughter's. It's not your son's. Here's the risks. Here's the benefits. How do you want to handle this?
Exactly.
I want to stay at home. I said, okay, good. If you're going to stay at home, let's get rid of 4 of the cats. Let's pick up some of the extension cords that are all piling out of the,
Yep.
Let's get rid of the throw rugs. Let's make it as safe as we
declutter,
can.
put the ramps in,
Yeah.
get the stair lift between the floors, have help come in and make sure that you're bathing and eating.
So let's talk about that, the logistics of that a little bit, because a lot of people, I guess us all being in healthcare kind of know the ropes or the routes to take, but people listening might not even know where to start. So do you suggest, so someone's like, oh my gosh, mom or dad's here living in their house. They don't want to leave yet. We're still trying to have the conversation. What can I do to try to keep them safe, and what help can I get? So do you recommend starting at the physician's office, a social worker? I know things are a little different in Canada for home health access, but why don't you talk us through the process for our listeners that just go, well, I don't even know where to begin?
My first plan of attack is what government programs are out there. Start with the government programs, whatever that looks like. Are you a veteran? Do you have veterans benefits that can get you transportation? Can it get you renovation? Are there programs where you live that can help you put in a walk-in shower, that can put up ramps if you need them, put up grab bars, whatever that looks like, that the government will help you do it. Like, get that help, get the freebies. Start with free. Are there other seniors or other organizations that will come in and help? Get the freebies first. Then start looking at what is your financial situation? Because I can tell you, go and hire, a home health care aide, go and get a physiotherapist to come in. But if you don't have the financial wherewithal to do it, those suggestions aren't going to help you. You have to have a really good idea of your financial situation, and then look at what you can afford and do what you can afford. If it is getting somebody to come in and do bathing because you need it, or is it someone to do food prep, or is it Meals on Wheels, or is it a respite so that the children or the spouse can have some rest? And that's what's important. You have to look at what are the priorities and how much money do you have to put toward them.
Right.
And, when we're talking about congregate care, I don't know what it is in the US, but I will tell you that somewhere half decent in Toronto now for a 1-bedroom is a good $6,000 or $7,000 a month.
Wow.
It's about the same.
No,
it just money converts different. I mean, but it's similar. I mean, so I guess you could say it's more money here.
Yeah.
But
I'm thinking, so it probably depends where my dad is right now in Western Canada. He's in a 1-bedroom and it's $3,800. So it's not too bad.
It's not Toronto though, man. That's
no,
like,
I'm just saying, like,
in
a big city.
Yes, it just
And
depends.
if you need assisted living,
Yes.
it's $10,000 a month.
Yep.
And if you're looking for dementia care, it's $12,000 and up.
Yep.
Yeah.
Now, on the other hand, there is government-run long-term care that is standardized. It doesn't matter where you go across the province of Ontario, it costs the same, and it's about $2,500.
Right. So
but it's different. I mean, that is an option. For various reasons, it's very hard to get in, and that's the challenge, is that you may have the need and not the availability. But I think that the financial aspects are really, really going to play into what you can and cannot do.
I think that is an unbelievably great point. My parents were in a wonderful private facility in British Columbia. The prices were exactly what you said, like almost to the cent. My father was in full care because he needed that, but only for about 18 months. So that's pretty successful, I would think, get to almost 90, 18 months of nursing home style care and then pass away. My mother was in assisted living until she had a terminal illness, and then it was hospice. So that, really a success story as far as care, but they could afford it.
Right.
And so they got to live in a really nice place. The other thing that people don't understand, especially our American friends, is if you go into the public system as far as elder care in Canada, you're going to go where there's a bed, which might be 35 miles away from where your kids live. It might be 75 miles away, and
more. Yeah.
And so here's my mother. If she would have had to have gone, not put her name in for a nursing home bed, needed a nursing home bed, gone into the hospital, had a catastrophic event that would require a nursing home for the rest of her life, she could have been an hour and a half away from where my sister lived.
Right.
And where she was living before was 10 minutes.
Right.
And, I mean, these are massive complications. And, it's a little advertisement for save some money. You don't want to be one of my friends who strangely enough owns a drop zone. He's a very successful skydiver. He's got probably 25,000 skydives. And he said, I knew I was going to get old. Well, he's either going to get old or die, right? That's one of the two things. He goes, I knew I was going to get old, and I knew I had a choice. I was going to be old and rich or old and poor. I chose old and rich. And I was like, good choice.
The other thing is in Canada and I have this, I have long-term care insurance. So that when I get to needing the care, it helps a little, not a lot, but a little, so that it's a little less of a burden for my kids, right? And I just said, this is where my priority is to make sure that I'm taking care of myself down the road. And again, I have the wherewithal to do that. The other thing that I really want to say is that even in the most beautiful retirement residence, you can't dump and drop. And that's what I see. Oh, it's beautiful. My parents are going to love it here. I'm just going to drop them off. Bye-bye. See you later. No, you have to be just as involved in the care if they're at home or if they're in long-term care, assisted living, or even independent living. You have to be involved because things happen and you have to be, or if not you, somebody needs to be eyes on the care of those parents because...
I mean, I'm living through that right now. My dad is in independent living, and it's almost, you have to, I wouldn't say do more, but he got himself locked out of the building and called my sister in a panic, and things are happening even more. He's at, because he's on the just independent living, it's really like an apartment with a bunch of other older people. And so meeting new people, trying to, he's not in his old place where he has the neighbors that know him really well. This is a new place. And just because there's a bunch of old people living together in a building, it's apartment style. And so you're right, you have to be just as involved, and he needs help with his appointments, etc. So absolutely. I was going to say, let's talk a little bit more about long-term care insurance, because that's one of the things that even us, we kind of think about it a little bit and then, talk with our financial planner. But any suggestions on figuring out like how to plan if you need it, if you don't? Like some people will say, well, I have enough money in savings that it's not really worth it for me. But any thoughts or suggestions on getting that?
I'm not an insurance specialist, so I don't really want to even talk to it. I have a close friend of mine who is, and she's been on my case for literally 10 years to get it. And I finally did. I see that the costs are just going to go up. And I see that in Ontario, what is going to be covered is going to go down.
Right.
It just has to be. So I just want to have a cushion. I want to have something. And this insurance would pay for anything. I can go on vacation if I wanted to. If that's what I needed for a respite, I can take that money that month and go on vacation. There are other programs where it's very specialized and you need to have receipts and it has to be approved and different things. And that's just another mode of insurance. But I think unless you have a big stash of money, insurance is good.
So that's the fact that we just brought it up in the podcast today. Hooray. people will be thinking about it, you can check with your insurance agent, financial planners, or someone look into it. Because there's you're right, a whole host of options. You can buy the basic to covering all kinds of things like you said you're doing. And the price varies. And I think obviously the longer you wait, the more the premiums are.
Yeah,
so,
no, exactly.
So now I'm thinking,
part
Tim,
of how part of how the metric works is if you buy it early, you might die and never need it. I mean, let's be honest, right? It's like reverse. It's like reverse life insurance. If you're 85 and buying long-term care insurance, it's probably going to be really, really expensive because they know you're almost 100% going to use it.
Right.
So that would be a good one, May. We're having an episode coming up fairly shortly with a financial advisor, and just say, hey, how do you factor this in? Because I mean, it's almost a goal. Like you should be able, I mean, don't we all want to live long enough to be prosperous enough that actually someone has to hold our hands later on in life? I mean, I don't really want to die at 55 or 60. I'd like to do some cool stuff for a while.
And, the other thing is nobody wants to like burden their kids, run out of money, and have them paying for all that stuff, or get stuck in a government facility or any kind of facility that is just bare bones and horrible care because you have no money. So a really good thing to think about for sure. Yeah. Okay. Good.
Tell us, go ahead, May. And then I have a question.
I was just going to ask, well, you asked the question because I wanted to elaborate on dementia care, etc.
Yeah. I was going to say, what kind of services do you provide as far as your like the nuts and bolts of what you do in your consulting?
So really what I start off with is exactly what I said. What are your concerns? What do you see as issues, and how can we address them? And what is your financial situation? What is your social situation? Who's there to help you? Who is not there to help you? What is your health situation? And putting all of that down on paper and having everybody see it. To say, this is the big picture, guys. Here it is. This is the big picture. And this is the projected future. And it helps sometimes to have those health professionals say, well, right now the dementia is at a mild level. And if things go south, then, you can expect this, and this is the kind of care you might need down the road, or with any other, cancer, whatever other disease that it might be. Having that full health picture is very useful in creating a plan. And that's the idea, is to create a plan. And then who is going to do what? And sometimes it's the kids that take it on. And sometimes it's people like me or geriatric case managers, because the family is not living in the same place, or they're not capable or willing. And a third party has to be the overseer. It just happens. Another part of what I do, that is more the sort of interaction I have with families, but I also do a lot of presentations for seniors as a group on things like successful aging, or doctor-patient relationships, or ageism, or a whole bunch of different things, so that I can educate a whole bunch of people at the same time to learn a little bit more about things that we don't generally talk about.
So that I want to get to the doctor-patient relationship, because this is something that just never ceases to blow my mind, which is, number one, patients need advocates. I don't care who you are. I mean, I ruptured my appendix at 38 years old, and I still needed an advocate because I was absolutely wasted on morphine by the time May had showed up to the hospital. So you need someone to kind of speak for you. The other thing is, and I think that you would be much more adept at doing this because you have kind of a coaching role where we're seen as these experts and whatever. And I just do what my doctor tells me. I ask patients all the time, that are in their 80s and 90s, why do you take these pills? I don't know. They just give them to me. And I'm like, really? Okay. So, but the other thing is you take your elderly parent to the doctor, and then you've had these massive discussions beforehand about all these issues, and then they don't want to talk about any of the issues because it's like they don't want to bother the doctor because the doctor's busy. And it's just, I mean, if I had somebody like yourself being able to counsel some of these elderly folks before I saw them, it would make everyone's life so much easier. It's like, okay, bring your medication list. Here's the 5 questions. Give the list to the doctor. If you forget something, it's already written down. I mean, there's so many practical things you can do. I don't mind a list as long as I'm holding it in my hand, because then as the physician, I can prioritize time-wise what's more critical. The key to the list is not that a patient comes in with a list, because most doctors hate lists, is that you have to hold it in your hand and take it from them. Because it might take 3 visits to go through the list. That's fine. But at least I know what's on the list.
Right.
I'm not, my hand's on the door and they're like, oh yeah, by the way, I had chest pain last night and I was super short of breath. Excuse me?
Yeah, I know. So I actually have a piece of paper that I suggest that they take. And on the top is the medications and other things that they take. So let's say they're taking herbal remedies, vitamins, over the counter, whatever they're taking. Those things are included, not just their prescriptions, but anything they're taking on a regular basis. And do they drink alcohol? Do they smoke? And do they drink a lot of coffee? All of those things that are really important. Then at the bottom, it's here's why I came. These are my symptoms. This is what I tried. This is what worked. This is what didn't work. And you only get to ask 3 things. 3. And you have your question here, and then there's a space for the doctor to fill in the answer. The doctor needs to fill in the answer for you so that when he walks out the door or she walks out the door, you're not going, what did they say? I forget. Oh, how do I take these drugs? What can I expect for side effects? Am I supposed to take it with food? I don't know. The doctor's responsibility is to answer the questions. And I've told patients, do not let that doctor out of the room until you understand what they're telling you. That's their responsibility, is to make you understand what your role is in your healthcare and what you need to do. And don't let them out of the room until you've got that. And don't let them talk to your kid and not to you, unless you don't have cognitive ability. But if you have cognitive ability, the doctor's responsibility is to talk to the patient,
Yes,
not to the other person. And I've seen it myself.
Yeah.
And I remember my mother saying, excuse me, I'm the patient. Don't talk to my daughter.
Yeah, that would drive me crazy about colleagues, residents, people we're training, talking around the patient. And I'm like, even if they're kind of demented, talk to the patient, because
Exactly.
you don't know how much they're absorbing or not, but address them and then can have the conversation with everyone else. Absolutely. Treat people with respect. Yeah.
Yeah, I love this pre-filled out piece of paper idea.
But it's almost, Tim, like what we get from the nursing home facilities. They would come in, and it would drive me nuts sometimes when I was working, because when we worked urgent care, we would get these, and it would be something simple, but it would write down all the prescriptions, the treatment plan, care plan, and I'd be like, for something this simple. But it's especially when someone's going home with it. You're right. You, as a physician, we need to be answering their questions and making sure they understand, and not skirting around the issue. But then for family members that couldn't be there, that wanted to know, well, what did the doctor say? There's no misinformation or misinterpretation of what the physician said. So it's written down. People that weren't there, family members that weren't there, care facilities can see it. People that have memory issues or mix up things, then it's written down. I mean, I know my dad goes to the doctor with my sister, and then I'll ask, well, what happened? Oh, I don't know. Your sister knows. And my sister, even sometimes with certain issues, and she's a nurse, will say, well, I'm not sure why, blah, blah, blah. But you're right. If you're committed to, as the doctor or the healthcare professional doing that assessment, writing it down, everybody gets to see it. That's the plan. I love it.
One of the things that the doctor that I worked with explained to me that I think is the golden standard. Is there's a difference between someone's disease and their dis-ease. And the dis-eases are rarely spoken of. And that's the important part to the family, not the disease, it's the dis-ease.
Yeah.
It's how does the disease affect my life? How does the disease affect my family? What am I going through? What am I feeling? I'm a holistic person, and very few health professionals of any, dealing with anybody of any age, ask people about their dis-eases.
No, that's a really good point. I mean, we're used to, say, occupational medicine people doing that. How does your condition affect your whole life or your job? Or instead of, and as physicians, we know better. And if a family doctor or internist has time, or geriatrician, I mean, they do that, but not as much as they should. Is it, you're right. If someone has cancer or dementia is coming, I mean, people know what's going to happen, but all the other impacting things around their life, like how's it going to affect my ability to go out, or this social activity that's very important to me, or my living situation, or simple things.
I think a really good question is, and it just kind of came to me, I don't know that I've really done it that much, and I'll do it more after this conversation, is really, what are you scared of?
Yeah.
Because that gets to the whole dis-ease idea. It's okay. I'm scared that my incontinence will happen when I'm at the Legion, and so I don't go hang out with my buddies, because if I have a couple beers, I have to pee, and I'm scared that I'm going to pee my pants in front of my friends. That's a really big deal, and that's a really important activity for somebody with that's their main social activity. These are their buddies, and sometimes it is really random stuff like that. I'm scared that I'll never be able to stay in my house, and I want to stay, die in the same bed that your mother did, or whatever. I mean, this is your life.
Yeah.
And
I
so
think
often
people listening, aside from the medical people, but even for kids or family members to have this conversation with their loved ones, their aging parents, is important too, right? It's like, okay, we're going to go talk to the doctor about your memory, but what are you worried about, or what are you thinking about, anything long term?
Yeah, and I think that it's a good question, and I think asking the kids, what are you scared of? Because I can tell you, there's a lot of kids that are going to say, I'm scared I'm going to have to, wipe my parents' bum.
Right.
I can't do that, or I'm going to have to make decisions about things I don't want to make decisions about. Or, or they're going to run out of money. And I don't think that's that like those conversations you want to have outside of the parent being there.
Right.
But it's not something that the children of aging parents readily speak about. They may think it in their own mind. And that's, you were talking about guilt. That's where the guilt comes from. Oh, how can I be thinking about myself? What kind of person am I to be thinking about me, not wanting to, take care of my parent, or being afraid that something's going to happen, or what kind of child am I? But it's normalizing it to say you're normal. We all think that, it's the same thing. I have a whole thing about grieving and how to deal with somebody who has lost someone. And the things that we say to people that are so ridiculous. And to think, what would be helpful in this moment? What would be not helpful in this moment? Oh, they've gone to a better place. What if I don't believe that? That might be your belief. It may not be my belief. Now you're just pissing me off because you're saying something that I don't believe. And we think we're being helpful. There's so many areas where I see education is key. And we don't know everything. Nobody knows everything. And that's what we have to just be okay with. That, we're going to make mistakes. We're going to do the wrong thing. And we're going to learn and do better. and it's okay. Nobody, I don't see anybody walking around with a halo on top of their head. And
King Charles, or that was a crown, I guess.
Well, and even he looked pretty, and I can say as a Canadian, he looked pretty funny, but that's
well, he's always looked funny. It's amazing what centuries of inbreeding will do for your
right.
So that's a bunny trail. No,
Can we talk a little bit about I want to segue into just talking about caring for parents, even with help or without, with dementia, and how to get through that. I know that's like a whole topic itself, but even just the generalizations in like places to start from. So how do you make a decision on whether to get them into, assisted living or dementia care, and how do you get around that? And then into, we were talking about this earlier. So my sister and I are both healthcare people. My sister's a nurse. I'm a doctor. Our dad's getting dementia. He knows it. And I think it frightens him because his sister has complete end stage Alzheimer's. He knows what's coming. He knows his memory doesn't work. But sometimes, we're human, even with his repetitive questions, it can wear on you. We all handle it differently. Some days are better than others. Some days I can go dissociate and go treat him like a patient. And so it's easier to do. Other days I'm like, he's driving me nuts. Why is he asking? And then there's the guilt. So do you have any tips, suggestions for people that are taking care or helping their parents get into care facilities, and how do you suggest they ever get counseling themselves? I mean, I don't know. I'm just throwing out a big fish of everything.
So it's hard. It is like those decisions, because I've had to do them. So I can tell you, as a child of parents that had dementia, my mother's dementia and my father's were so different. They're both Alzheimer's, but you would think it was a totally different disease. My mother was aggressive and combative, and she ended up in a psych ward for 5 months because she was off the wall. And my father was 180 degrees the other way, calm and quiet and happy, and lived on and in the farm. I'm on the farm.
A lot of people don't understand that. And, we have that conversation as doctors with friends and patients that, yes, the personalities that come out in dementia, I mean, can be like a brain tumor. You just can't.
Very different.
Yes.
Very different. And so, in terms of what is needed, again, it's sitting down and saying, here's today where parent is. We don't know if, dementia can go like this. It can go like this. You don't know what's going to happen. And you have to roll with it as it is, because you don't know what's going to happen. They could stay at a certain level and then all of a sudden drop off, or slow decline, and you don't know. You have to just keep your eyes open and plan ahead and know what's possible. I really believe in getting help. So, the Alzheimer's societies, I'm sure everywhere, have resources and help. Good support for people who are the caregivers and supporters. There are lots of support groups for caregivers. And use them. Like, I really think use them. It's hard when the person knows they don't know. Because they do in the beginning. They know they don't know. How come I don't? Oh, I'm so stupid. I'm losing my mind. And then comes a time where they don't know they don't know.
Yeah.
And for them, it's much easier. Right.
Right.
But for us, it's like, whoa, now they're in a whole different realm. And you have to be able to, when it's really hard, when it's the same question, what day is it? What day is it? What day is it? What day is it? And you just want to go, oh my God, I can't listen to this for 5 minutes more. When you get to that, get up and walk away and say, you know what? I'll be back in a minute. Walk away for a minute like collect yourself, because otherwise that frustration can make it such that you just say, I'm not coming back. I can't do this. And in the beginning, I know, like, when you're not sure if somebody has dementia or not, and they're forgetting, and you're just saying, well, why aren't you doing that? Why aren't you knowing that? How come you don't know where your keys are? And then 6 months or a year later, you realize the person had dementia, and the guilt that you feel, like, oh, if I had only known, I would have been nicer. You have to let that part go. And a lot of people feel that. If I had known that this was going to be this, I wouldn't have been like that. I would have been more understanding. I had it with my own mother. One of her friends had dementia, and they were playing a card game, and she was very slow. And my mother at the time had COPD. And she said, I don't understand why she's so slow. And I said, if somebody said to you, walk faster with your walker, what would be your answer?
Right.
I can't. And I said, neither can she.
No.
You have to understand that she's doing her best, you're doing your best, and that's how it is. And it may not, you may not have full understanding of everything going on, but understand that they're doing their best.
Right.
Yeah,
It's like watching.
I try to tell, myself, my sister, patients, friends, that you can't take some of that stuff personally, because the behaviors that come out or the repetitive questions, it's not an attack personally. And even if it is, you have to learn to let it go. But also I just say, almost treat them like, if you've raised kids, like a toddler, like a young infant toddler, just doing things over and over, because that's how they learn. But you have to have that patience, but the ability to go, they're just going to do this over and over. And that's the way it is. And you're right. If it's to the point where you're like, okay, I need a break. What do you do when you have a young child? I mean, the healthy thing to do, right? Walk.
Well, obviously vodka, but that's a different. But I think May's
healthy
point,
outlets, Tim, healthy outlets.
Yeah, I think May's point about the child part, we can bring some of the medical side in here on that, which is, people actually do revert to a childlike state to the point, which is fascinating, which I think a lot of our listeners will find amazing. If you're demented enough, you actually start to get infantile reflexes back that you only had when you were a baby with an undeveloped brain. Mm-hmm. Like some of the rooting aspects of looking for the nipple and all this kind of stuff that an infant does, because its life depends on being able to suckle, to eat. That stuff, if you're demented enough at the end stages, comes back. So you really are dealing with it in a lot of respects, an infantile, I can't even say the word, of your parent, which is really difficult. And you've talked about grieving. I think it's really powerful for people to understand that this grieving is not just when people die, because it's multiple losses over a long period of time. And that's what makes it so painful. I remember when my dad had his first stroke, maybe within a year or so after that happened, he wasn't my dad anymore. I mean, he was still mostly there, but my dad was this very sage, very wise person who would listen to everybody, and then, usually could sum up things in a few words. And he was just kind of like a kid. Yeah. And, because that's what the stroke did to him. And you have to grieve that. Like, people said, when you pass away, like, are you really sad? And I go, well, yes and no, because I already grieved that loss for the last 10 years almost. Yeah. And it's people need.
Yeah, that's a good point. I think that it's okay for people to realize that grieving now, even while they're still alive, is valid and normal, because they're still alive, but you're grieving for what they used to be, because they're not the same person anymore. Obviously, with dementia, it's easier to say this is not my parent anymore. But through things like stroke, even major surgeries where they lose cognitive factors that happen, bypasses, and cancer, mental changes that happen with metastases, and metabolic diseases like renal disease affects all kinds of things, not just physical function of the parent, but the mental and liver disease, as you know. So I think that grieving that's going on and is good, important, and not to deny those feelings, even though your parent's still alive. And for people to acknowledge that.
Yeah. And I think what you said about watching your parent, there's a commercial that I've seen for Alzheimer's, and it shows like a head and then little pieces are like floating away. And I thought, wow, that's exactly what I'm watching happen with my dad. Little pieces are floating away. Now, I'm very lucky that neither of my parents stopped knowing who I was. I was very lucky that both of them, they lost lots of other things, but not that. So they always knew who I was. They, I never lost that connection. And I cannot imagine going to see my parent and them not knowing who I am. As hard as it was for me, there's always a level that somebody else might be experiencing that is even more, oh my God, I don't know how you get through that. And so you have to be grateful for what you do have. And I think that that's something that we forget, to have that gratitude for what is still there. Because as I said, people become more of who they are. My mother was very feisty all her life. And that's who she was when she had dementia. I mean, that's who she was. And my father was always laid back, and that's who he was. And I got to know the new him, who lived on a farm. Now, my father never lived on a farm, but that in his later stages, that's all he talked about: the horses and the chickens and the pigs and the whatever. And I went with him. You see, that's the other thing. If you go with your parent where they are, you can live a little bit in their world. When you are closed off to thinking, well, they're just, cuckoo, and you're not engaging yourself, and you're not asking the questions and making them feel like you're still part of their life, they get that disconnect. But when you go, yeah, wow, it must be great. What do the horses look like? What's it like to go and, get the eggs from the chickens? What is that like for you? And the other thing that I say is take lots of pictures and lots of videos, because that, when your parent is gone, that's your parent. I have pictures of my mother singing. It's hysterical. And I was doing a grant asking about how you decide if you should live in your house or move. And I asked my father, well, how was it when you moved? Now, my father at this point had pretty moderate dementia, but I have videos of my father talking about, well, when we made that decision to move, it was really hard and I didn't really want to do it. And this, I missed my driveway and I missed, my lawn. There's still valuable stuff in there and you can pull it out.
Yeah, those are great points. I remember Tim did that with his parents while they still were together living at home, and just interviewing them. I can't remember, was it for their anniversary or past that or somebody's birthday?
Well, no, it was because
asking them questions about what it was like when they were young. And I mean, that's very elaborate. And when they got married and life was like back then, and fears and business decisions.
And all those files are gone.
Is that right?
I don't know where a single one is. I've searched and searched, and it's absolute gold. I asked my dad what his first job was. I was 5 years old, he said, and I delivered goat milk to the children that were allergic to cow's milk.
I think those files
were working when he was 5. It
was another computer that broke down.
Yeah, so I know I was like 1932. Yeah, I mean, just I hopefully I can find it, because it'd be easy to edit it together, because it's really, really good. But I mean, I had no idea about the history of I had no real idea of the actual narrative history of how my parents, built a business, did X, Y, and Z, until I just sat down and asked them. It was just all kind of assumed knowledge, which means you don't know anything.
Yep.
Which I think is a really good point, maybe to kind of wrap this up. But, as I look back on what we discussed, which is very valuable, to kind of put it in a nutshell from my perspective, and you can add anything that I may be missing, is number one, talk about everything. So talk about finances, talk about burial, talk about what you want medically, talk about where you want to live, talk about when you want to live, where you want to live, at what stage would you be willing to consent to leave your home, et cetera, et cetera. Talk about all of it, because it's weird. Like May's family is so much more open in some respects, but not my family. Like my parents would never talk about money, which was just because, well, we have enough money, we don't need to talk about it. Well, that might be true, but if you're both totally disabled, we all four of the kids need to know what the resource allocation is, Yeah. I mean, just, lots of information, talk about quality of life. That's the goal. So information, what's the goal? And then the other thing, that's the elephant in the room that no one wants to talk about, which is safety. My mother used to take my disabled father that had 2 strokes, put him in a tub, and then she'd get in there naked with him, standing behind him in the shower, because they didn't have a walk-in shower. They had a tub shower.
Right.
So there's these 2 80-some-year-olds naked, which is horrifying in and of itself to think of. And she's washing, and literally I had a conversation with her. I said, so you're trying to kill both of you at the same time? Oh, no. This way I can just, we're both clean. And I go, no, you're going to be both dead.
Yeah, you fall on top of them and crush them.
Well, exactly. I mean, she'd get all upset with me. I said, your mother died of an accident. No, my mother had a stroke. I said, your mother was found in a bathtub with her head against the faucet. That's called slipping and falling. And that's the last thing I'll say, as far as like the grab handles in your house, getting rid of throw rugs. This stuff is life and death. Yeah. There's about 40. I was looking it up just a little while ago because it piqued my interest. There's around 44,000 people a year in the United States that die from falls. And it's not base jumping. It's like tripping over your cat.
Yeah.
Or your carpet, or the plug, or who knows, or the lighting isn't strong enough, you can't see, or there's newspapers around you, up to here. But there are people to help with those things. If you want to live in your house and it's not a safe place, that's the thing. You can make it a safe place and live where you are. Just do the work. If you want to stay there, make it work. Make it safe.
Any last thoughts on, so much more we could delve into, but as far as the basic planning with family and parenting and aging, any last sort of thoughts on that we haven't covered?
Just do it.
Yeah.
Because the sooner you have a plan in place, the sooner you'll breathe. And the other thing is, be okay to change the plan.
Yes.
Because you may plan today and 5 years down the road, health changes, finances change, circumstances change. You may have to make changes. And don't guilt each other out if somebody decides, hey, you know what? I can't do this. I can't be hands-on. I can't help here. It's not in my realm. And people think, well, it's a cop-out, it's your parent, blah, blah, blah. I have learned that everybody is going to handle how they handle, but give them the opportunity to show up, and then what they do, they do.
Perfect.
That's
really great. So how can people find you, and
how can you find me?
Connect with your resources?
But Toronto and see me. But you can email me at janice@talkaboutaging.com, because I think we need to talk about aging. It's also my website, talkaboutaging.com. I have a page on Facebook, Talk About Aging. Plus, I also have one that's called Aging Parents. I'm happy to talk to people. I'm happy to provide education, on Zoom. If somebody wants an educational program, I have many things that I talk about. And I talk about the things, I wrote a book called Getting Older But Not Old. And in there, I talked about dating and sex. Now, a lot of people don't think that older people date and have sex, but my father asked every woman in the residence he was in to marry him. So, they still think about it, and it's a valid aspect of one's life to want companionship. So
No, I remember my grandmother passed away before my grandfather, and he was very cognizant and, like, mobile and all. And this was back in the early 80s. He had before we had cell phones, so he had one of those cordless phones he could take throughout the entire residence. And he was just in just a senior apartment, and he was in a different, like, we'd call him and he's like, "Where are you?" And it was at a different women's room almost every other day. It was like a rooster in a hen house. I don't think morally he was doing anything necessarily untoward, but he was, man, he was like Casanova in there, man. Unbelievable.
Yeah.
I get it.
Awesome. And your book, is it available? So can people find your book through your website then, that link that way?
You can email me and I will, I'll hook you up with it. And that's actually in my book is the 25 documents.
Okay. That's what I was just
list to have to,
yes.
I'll send that to you separately, but,
perfect.
Being prepared, like the Girl Scouts, be prepared. That's the best advice I can give, because you don't want to be blindsided. You don't want somebody to say to you, you've got 24 hours or 48 hours to find a place for your parent because they're not going home. Right. And you have no clue.
No, we need to continue to normalize these conversations, just like we push having the sex ed talk with the teenagers. I mean, I think as our society, the baby boomers and us get older, it's easier to do, but I think it's still something we need to.
But there's still a lot of weirdness in the baby boomer culture, because they were the first culture of youth, right? I mean, it used to be that you turned 18, you went to World War II, whatever it was, you went off to war, you went off to college, you were a grown up, you're a grown up at 18, take care of yourself, see you later, work on the farm, whatever the case may be. And the first real youth culture was really the baby boomers, where, we had muscle cars because of that. We had certain kinds of music. We had all of these things that, evolved through the 50s and 60s due to that massive number of generation. So they don't like getting old, and plus now you have 60, 70, plus year old people doing action sports. I mean, I've skydived with guys in their 70s. There's guys kiting. I just spent a week kiting in North Carolina. There's guys in their mid 70s that are still out there, like, destroying the place. So, now you have athletic injuries and geriatrics, where before they just played shuffleboard. So it really is an interesting dynamic.
True.
Yeah.
Well, thank you so much for your time. This has been amazing and really helpful. And maybe we can have some other conversations in the future about more specific topics. There's always so much to talk about. And as we all get older, it's going to be more important. So thank you so much again, Janice, for being here.
Thank you for having me.
All right. That was really informative. Like I said, for a lot of people, most of us, if we're privileged to have our parents with us for most of our adult life, are going to have to deal with caring for elderly parents. And if you don't plan ahead, the light at the end of the tunnel is absolutely an oncoming train. So I think that's kind of the theme I took away from it.
Yeah, I hope that people I'm sure everybody's going to get something really useful out of this. I'm sure there's a lot more. And if you want to hear more, shoot us an email. We'll have her back on and talk about those specific questions, because there's so much to talk about. And you and I both know it. I mean, we've lost 3 of our 4 parents now. We've gone through so many different things, right, with each of them. Terminal illnesses, care issues, 3 of the 4 parents being in care facilities. It's all different. Every situation's different. And like she said, be prepared to pivot and change, even in a 2, 3, 5, however many unit of time period. You think the plan is this, and then things change, and be ready to pivot and make changes. I was taking care sort of my dad, and then he moved countries, and now my sister is, and then there's changes within that system. And you might start off with the plan is to stay at home until I die, and then things change and you can't do that, and vice versa. So, and we know so many horrible stories of friends and patients where they did no life planning, and things happen. And we don't all die when we're elderly. We all, many of us die young, sadly. And if you haven't started this conversation yesterday, you're already behind, because something can happen. And if you're the one who doesn't have to pay the bills, know where all the bank accounts are and so forth, you're going to be in a world of hurt trying to figure that out. And sometimes it's very painful because you legally don't even have access. So it's not just for elderly. Life planning is for all of us, right?
Right. And I was very encouraged to hear that in my 80s, I'll still want to have sex.
And I will make sure that you get that, however that may need to happen. If I'm around, I'm thinking maybe I'll just send you off like grandpa with the cordless phone and visit all the ladies. I'm kidding. That's pretty funny. But you know what? That's a serious topic. Maybe that's something we could have her back on to talk a little bit, because a lot of you younger people might be thinking, ew, gross. But hey, sex is part of living for a lot of elderly people, believe it or not. So,
well, as the ladies' man said, that's disgusting.
Let's leave it at that for today. Yeah. Anyway, we're going to try to get this episode going out on the video channels quickly, because Janice would like to repurpose it and we'd like for you to see it. So check it out if you want to watch on YouTube and Rumble. Tim's going to put this out there. Anything else you want to say as far as life going on? I'm kind of liking this being apart, doing this from afar. So maybe I'll extend the vacation. We'll do some more recordings. Any thoughts? You're holding down the fort. Okay.
Yeah, I'm just going to wait until there's a layer of flies on the dishes before I do them. Stuff, my bachelor stuff that I never got to do. Actually, I just came back from my kiting trip, and those guys are kitchen ninjas. It's hilarious. I was bugging them about it. It's like they literally are cleanup ninjas.
Nice. So maybe you gleaned some lessons. It's okay.
No, I just figured that I'd done enough cleaning already for the last 2 weeks. So
got it. Well,
but the cat really does need to learn how to lick his paws after he uses his litter box, because he's a litter flinging machine.
He needs to take some lessons from Puss in Boots.
Puss in Boots.
But on that note, see, you just appreciate how much cleaning I do after the cat when I am home. And now you notice.
Yes.
Because now you got to do it. So anyway.
All right.
That'll keep you young, keeping up after the cat. And on that note, thanks for listening. Check us out on our Rumble page and, of course, the YouTube page that's being built. And I hope this episode is one that's widely shared and you get your things in order and have those conversations. And we will see you next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.